All right, so now let's look at the bone. So when we have a client who has a healthy mouth, or even when we have a client who has inflammation of just the gums alone, so gingivitis, their bone would be intact. What I want you to gather from this is that in health and even in gingivitis, the bone level is intact. And to be very specific, the bone always starts, or it's right, the crest of the bone rather, is located just 2 millimeters below the CEJ, or 2 millimeters apical. Apical means below the CEJ. So this is normal. Okay, so in health, we see bone like this, and with gingivitis, which is just inflammation of the gum, the bone is not affected, we see that the bone is just 2 millimeters apical or below the CEJ. One thing I did not mention in the previous video is that we know that gingivitis is reversible. So if someone has gum disease and their gums are inflamed, if they visit a hygienist regularly and if they brush and floss and take care of their health, then it is reversible. The gums can return back to health. But unfortunately, with periodontitis, when the periodontium is inflamed, we can see that there is bone loss. So instead of the bone being over here, the bone has resorbed. And in this case, this is quite severe. Severe periodontitis is what we're looking at here, because the bone has resorbed significantly. So much that the tooth can eventually fall off. There's nothing. The bone is supposed to be there to hold on, to support the tooth. And in this case, we don't see that. So here we would see mobility. The teeth will start to shift a little and become mobile and loose. And the reason for that is because the bone has been resorbed. So this statement over here, bone destruction may eventually lead to tooth loss, is absolutely true. So when someone is losing bone, when there is bone loss, there are two patterns that can happen. One is horizontal bone loss, and horizontal bone loss basically means that when we're looking at the bone in between the teeth, it is a straight line for the most part, right? It's horizontal bone loss. And when you can draw a straight imaginary line like so, that means it's horizontal bone loss. So typically, normal bone would be right over here, 2 millimeters below the CEJ. However, when someone has bone loss, it goes below the normal ideal level. So with the horizontal bone loss, if we look over here, instead of it being a nice peak where we would see the alveolar crest, which would crest up and have a nice peak, we see a little bit of fuzziness like so, and a straight line can be drawn through. This is the most common type of bone loss that we see. Now, sometimes someone could have vertical bone loss, and vertical bone loss is when you can draw a diagonal line like so. So it's not a straight line parallel, it's a diagonal line. And this is the less common type of bone loss. This is also more severe. If someone has vertical bone loss, their bone loss would progress even further. So it's a rapid progression. We don't like to see vertical bone loss. It's not a good thing to see. It's more severe. And so if you look here at this picture, you can see that there is vertical bone loss where the bone loss is diagonal. Now let's look at how this happens. So if someone has horizontal bone loss, which is like this, what happens is when you get inflammation, so when the gums start to get inflamed, the inflammation goes a certain way. So it goes into the connective tissue. So remember, this is the epithelial tissue, this is the connective tissue, which is in between. So the connective tissue gets inflamed, and then the bone gets inflamed, and then the PDL gets infected. And that's how we're getting horizontal bone loss. It's going this way, and that's why you can see a straight line over here. When the inflammation goes this way and the bone is resorbed this way, we see horizontal bone loss. But when we're looking at the vertical bone loss, the inflammation is going a different way. And if you look here, it's going through the connective tissue, which is this light pink tissue over here. The inflammation is spreading this way. And then the key difference is that it's hitting the periodontal ligament space and then going to the bone. So that's why it's a different pathway, and that's why you get vertical bone loss. Now, why? Why is it that it's a different pathway? Well, the reason is because the periodontal ligament fibers are weak from before. Why could it be weak from before? Well, perhaps this person is grinding or clenching, and anytime you put your have occlusal trauma, anytime you're grinding and clenching, the periodontal ligament fibers becomes weak. And when it becomes weak, the inflammation likes to go this way because it's already weak. The periodontal ligament fibers are already weak. So it would go this way and then affect the bone that way. So this is the more harmful, the worse. We don't like to see vertical bone loss because it progresses this way, and because the periodontal ligament fibers are already weak.